Let's go live to Annastacia Palaszczuk in Queensland.
And we have been in a public health emergency since January the 31st. And we need to continue to do whatever we can to keep Queenslanders safe. So I want to talk about a couple of issues today. The first one is that from 1 a.m. tomorrow, if you are a New South Wales resident in Greater Sydney, please do not come to Queensland. This is very similar to what the Victorian Premier also announced today. Secondly, if you are a Queenslander and you are in Greater Sydney, please return home quickly. We will allow you to come back till 1 a.m. Tuesday, but you will be required to have a test into quarantine at home. Thirdly, and this is a message to all Queenslanders, we need to be on alert. I know a lot of people are out there enjoying holidays and getting into the festive spirit, shopping, and there's a number of things I'd like to talk to Queenslanders about today. Firstly, as the Health Minister and Dr Young stressed yesterday, we have concerns about positive samples of sewage testing in North Cairns, in Townsville, in Cleveland and the Gold Coast. If you have any symptoms whatsoever, even if they are mild, please go and get tested. That is absolutely important that Queenslanders do that. Now, we are having some issues with our pubs and clubs and cafes across Queensland. The majority of people are doing the right thing, and it's wonderful to see the QR codes and people are logging in. And also, like going to different surf clubs or whatever, people have got the electronic devices where you put your driver's licence in and that's being recorded. We are very concerned when we went to contact trace people at the Glen Hotel. There was illegible handwriting and we weren't able to get hold of everyone who was there during that time. That is not on. It is simply not on. So we are giving a very clear message to our pubs and clubs and cafes right across Queensland that you'll have 72 hours to get your house in order. And that means you must have QR codes or you must have electronic devices in place. Otherwise, you will be going back to the 1 per 4 square metres and people will not be able to stand up and enjoy their drinks. So please get your house in order. As I said, the majority of people are doing the right thing, but people now have had months to get their house in order. And we are in a serious situation, so that means we must be able to contact trace at any step in time. So please, this is really important because it's going to protect everybody. Also, everyone's out and about Christmas shopping, and we're seeing reports today that, billions of dollars are being spent in the Queensland economy. That's fantastic news, but we do need people to keep up with your social distancing. We need people to make sure that you are doing your hand sanitising, and if people aren't doing the right thing, leave the store. Leave the store and go somewhere else. But we absolutely need people to do the right thing during this point in time. Now, why are we making these decisions? These decisions are being made to protect Queenslanders and to keep Queenslanders safe. And what we are seeing in New South Wales is of concern. And when the New South Wales Premier says she's on high alert, we are on high alert. So these border measures are necessary. They are necessary because Queenslanders over the past 9 to 10 months have done a remarkable job. And no one wants to see happen in Queensland what's been happening around the world. And you only have to see what's happening in the Northern Hemisphere, where people in London and New York and other parts of the world will not be travelling much this Christmas because of COVID cases. And of course, today we only had 2 new cases of COVID in Queensland and they were in hotel quarantine. And I'm not going to allow anything to destroy our tremendous effort that every single Queenslander has worked hard to achieve. Finally, can I say to anyone who has come from Greater Sydney over the past week, please go and get a COVID test. I think that'll be peace of mind to you and your family and peace of mind to every other Queenslander as well. So thank you for everyone for the great work. I want to thank Dr Young for her advice today. The Deputy Commissioner will also talk about the measures that will be put in place. Of course, we've got measures at airports, There will be checkpoints that will be put in place across our borders, and we are please asking people to do the right thing. And if you are from Greater Sydney, now is not the time to travel to Queensland. We love you. We want you to have a peaceful Christmas at home, and hopefully in the months to come, we'll be able to welcome you back to our wonderful Sunshine State. But now is not the time. We want to contain what's happening in Sydney and New South Wales, and we don't want to see outbreaks happening here in Queensland. So I hope Queenslanders understand the strong messaging and the strong action and the strong decisions that I've had to take today, but we're doing it based on the health advice, and it is not dissimilar to what other leaders are doing also around the country. So I'll hand over to Dr Young to say a few words, and then the Deputy Premier, the Health Minister and our Deputy Commissioner.
So as of 1 a.m. tomorrow morning, Greater Sydney will be a declared hotspot. Now, Greater Sydney includes all of Sydney, and it goes south down to Wollongong, Wollondilly, the Blue Mountains, Hawkesbury and the Central Coast. So that is the area that the New South Wales Premier has put restrictions back into place. So we're taking that same area, and it will be a declared hotspot as of 1 a.m. tomorrow. But we will allow any Queenslanders to return home for the following 24 hours, so until 1 a.m. Tuesday, and get tested when they come back to Queensland and go into home quarantine. If they have a home that is safe and suitable to quarantine in, of course, to go into quarantine in their home for 14 days from when they left Greater Sydney. Anyone else will need to apply for an exemption, as usually occurs. So for compassionate reasons, essential workers, so forth, will need to apply for an exemption to be able to come into Queensland, and then they will need to go immediately into hotel quarantine. I would say that very, very few exemptions will be given, as is usually the case, but of course we will look at those. This is important because we have seen a continued escalation in the numbers of cases in Sydney, and here in Queensland we have removed so many of our restrictions, so we know if we were to get one case there was a real risk it would rapidly spread. Now, we could well get a case, and I am very concerned about those 4 parts of Queensland that have had positive sewage results. So that is Northern Cairns, Townsville, Cleveland and the Gold Coast. We don't test inner Brisbane because we know we'll get positives because that's where our quarantine hotels are. But some of those other areas, there are not rapidly explainable reasons why there are positives there. So I am concerned that we potentially do have people across Queensland who are active COVID-19 cases. So it is really, really important. If you have any symptoms, please come forward and get tested immediately and isolate yourself till you get a result. If you've come from Greater Sydney, so you've been in Greater Sydney 11th of December onwards, could you please make sure you get a test and isolate yourself till you have a result? These things are really important, so we pick up the first case in any cluster. And anyone who went to the Glen Hotel on that 16th of December, please, could you come forward, because there have been a lot of fantastic people who have come forward who weren't on any of the lists that the Glen Hotel gave us, and they've come forward because they knew they were there. The lists were incomplete, or some people had written out their names and we couldn't decipher what they'd written. It is really, really, really important. I cannot overemphasise it enough that when you go into a restaurant, a bar, a club, any place, that you must leave your details so we can rapidly contact trace you. It's now the 20th and we still haven't got hold of all the people who are at the Glen Hotel on the 16th. And that is a real risk, because if there's one of those people's positive, they're out there in our community potentially spreading the virus. So we have to go back to all of those fantastic things we were all doing earlier on. We've got to make sure that we leave our details. We've got to make sure we come forward and get tested if we have any symptoms. We have to maintain that 1.5 metre distance wherever we can. If you can't maintain the 1.5 metre distance, put a mask on. All of us need to make sure we've got a supply of masks so that we can rapidly use them if we need to, if we have outbreaks in Queensland. If we do all of this, we can get through this outbreak again, as we did with all of the previous outbreaks. I know it's tiring. We've done this all before. We don't want to do it again, but we need to. We've got to keep all of this in place until we're able to roll out the vaccine to every single Queenslander who's able to have it. Thank you.